be back. Hasta la vista.
Calculating cyborg relations. Sorry, John. I'm afraid I can't do that.
We're all concerned about AI taking individual jobs. We're even gonna talk about a few of those in a moment, but let's go a little bit broader. If AI does what many people think it's going to over the next few years and gets involved in many different aspects of our life, including battlefield combat, including our health system, what effect might that have? Well, there are a lot of studies being done now that predict pretty dire consequences. They're saying that yes, there are good, like if we focus on healthcare, there are some things that AI could do well. They could diagnose maladies that doctors might miss. They could come up with treatments that doctors haven't thought of. They could come up with new pharmaceuticals that scientists have had trouble developing. All of that is true, but there are some issues. Here are a few of them. The risks associated with medicine and healthcare, quote, include the potential for AI errors to cause patient harm, issues with data privacy and security, and the use of AI in ways that will worsen social and health inequalities. Here's one example. Was the use of an AI-driven pulse oximeter that overestimated blood oxygen levels in patients with darker skin, resulting in the undertreatment of their hypoxia. So look, from the very beginning of AI being a thing that we talked about in terms of news, there have been concerns about the biases baked into AI based on who trained them and what they were trained on. Racial bias has been a part of that from the very beginning. And it is not just, like the already horrible result where people are getting like arrested who did not commit the crimes they're being, accused of. Something down to so specific as your blood oxygen level. And if that can result in the undertreatment of hypoxia, imagine all the other things that an AI system that doesn't have the ability to exercise human judgment might also get wrong. The only one thing that makes me feel a little bit better about this is that this AI system that'll be diagnosing people that has racial bias baked into it will likely be replacing quite a few doctors who also have racial bias baked into them. So maybe it's just a wash. Anyway, our system sucks. Also, AI could harm the health of millions, they say, via social determinants of health through the control and manipulation of people, the use of lethal autonomous weapons, and the mental health effects of mass unemployment should AI-based systems displace large numbers of workers. So effectively, especially when you think about the healthcare system, there's a lot of concern that this could result in a lot of damage, even if at the same time it's producing better outcomes for some people. What it seems to be implying is that AI could produce an unequal effect based on your race, based on your economic status. So, similar to our system in a lot of other ways. Jared, what do you make of this?
Yeah, these are the things that that I think come across as some of the problems with AI, which, how can we tell beforehand? But then baked into these systems, it's just more across the board standard type of things. We're gonna, I think even things we can't imagine or dream of right now are gonna develop from that. Because I hadn't thought of the fact of maybe, as jobs get replaced and how that then helps people or affects people with their health care or their health in general, mental health and things like that. There's a lot going on. And as we're seeing it beforehand, it's one of those things that I'm afraid if or when this stuff gets implemented and then some of these results do occur, it's the who would have thought. It's just very simple. Look, we got cars that are driving on their own that are having their issues. Has that changed? Has that made people think and go, you know what? Maybe I should put my foot on the gas pedal and then the brake and then the steering wheel. Maybe I can do things like that. We're getting way too used just the normalcy of doing nothing that eventually we're gonna have to start accepting, just like we accept any other kind of violence or inequalities or biases within our societies. We're gonna just start accepting it because that's just the way it is, I guess. It's the biggest problem with this is I think as we see this come across, we're not gonna see tons of people at least think we have to stop or change this or change course.
Yeah,
that's just our human nature, I think.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.